Today at Quanta Laser Lab, we're going to talk more about laser vein treatments. Different wavelengths are going to have different absorption characteristics in the different types of blood vessels. For example, a 532 wavelength is going to have a very, very high absorption in oxyhemoglobin, or oxygenated blood, or red blood. Where that's going to be very, very effective is a high flow red blood vessel on the face, such as a telangiectasia. 532 and 595 both have very, very similar absorption characteristics. So a 532 frequency doubled ND YAG is going to have a very similar absorption characteristic as a 595 pulsed dye laser. Now the 595 pulse dye laser is going to be a laser that you see in a lot of dermatology clinics, and a lot of dermatologists have trained with that during their schooling. That 595 again is going to have a very, very high absorption in red blood. The 595 might be a little more flexible than 532, and dermatologists are going to use that to treat warts. They're going to use it to treat some stretch marks, scars. There's a few other things you'll see that 595 used for as well. Now 578 is kind of an emerging wavelength, again in that same sort of realm as the 532 and 595, where it's very, very highly absorbed in red blood. So it's going to be a wavelength that's very effective for use on facial vessels. 1064 nanometer wavelength, however, on the other hand, is probably going to be one of the most widely recognized vascular lasers out there. A 1064 wavelength does have absorption in the red blood, but it also is actually even a little better absorbed in deoxyhemoglobin or deoxygenated blood, or blue veins, what you might find on somebody's leg veins, that sort of thing. A 1064 laser is also a longer wavelength, or a deeper penetrating wavelength, and so it's going to be better for use on legs. Whereas 532, 595, 578 are really only going to be great for facial. The 1064 you're going to be able to use off the face as well. The other light-based device that you can use on vascular lesions is going to be an IPL. Now an IPL is going to be very similar to what we're going to see with like a 532 or 595, where it does great on the face, but because it's not a specific laser wavelength, but it's a broad band of light, it's going to do great on like diffuse redness on the face, like rosacea, or maybe poplioderma, some of those different sort of conditions, but you absolutely would not use an IPL on leg veins. So when you're looking at the different sort of wavelengths and IPLs, you really want to figure out what is it that you're trying to treat and make sure you're picking the best tool for the job. Call one of our aesthetic laser consultants today, and we can help you decide which device and which wavelength will be best for your aesthetic practice.